Major funding for these broadcasts is made possible by grants from Capital One Bank and Chase Commercial Term Lending, the Witkoff Group, New York Community Bank, M&T Bank, Greenberg Traurig, Perfect Building Maintenance, Genova Burns. Additional funding is provided by grants from AKA Hotels, Corman Communities, Aerial Property Advisors, AVR Realty Company, Bank of America, Merrill Lynch, Bank Leumi USA, Briarwood Organization, CBRE, Citizens Bank, Colliers International NYC, CPEX Real Estate Services, Cushman & Wakefield, Customers Bank, DDG, Dime Savings Bank of Williamsburg, Fisher Brothers, First Nationwide Title Agency, Flushing Bank, Foley & Lardner, Friedman, Handler Real Estate Organization, HAP Investment Developers, Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, James Orphanides, Chairman, USRealty.com, Kilroy Architectural Windows, New York's Window Company, Madison Realty Capital, Massey-Knackle Realty Services, Matone Group, Mercantile Commerce Bank, N.A., Meridian Capital Group, Newmark Grubb Knight Frank, Newbanks, MHP Real Estate Services, Optimum Window Manufacturing Corp., People's United Bank, Rosewood Realty Group, SJP Properties, Sterling National Bank, Sterling Risk, Stonehenge Partners, TD Bank, Terra CRG, the Continuum Company, the CUNY TV Foundation, the Moynihan Group, and these friends.
I want to be a baseball player. I want to go to Mexico. Maybe I'm going to go to law school. Maybe I'll be a writer. Nah, I'm going to become a psychiatrist. I'm going to go to Boston. I'm going to get involved with HMOs. Nah, I'm going to come back to my hometown. So today I have Dr. Andy Brockman, who is the Senior Vice President, Vice Dean for Clinical Affairs at the NYU Langone Medical Center. Thanks for being here.
Thank you for having me.
So you told me that your great-grandparents came here in the late 1880s. Right?
That's right.
So tell me about them and how they ended here. They were from Minsk?
Well, they came from Eastern Europe, sort of like many did at that time. Came in the 1870s, 1880s. And then the unusual part is one landed in Middletown, Connecticut, and the other landed in the Bronx. And all four of my grandparents were actually born in New York City.
How did Middletown, Connecticut arrive back in New York City?
I really don't know how that happened. And the circle was completed later on when I didn't find out they were in Middletown until I got into college in Middletown, Connecticut at Wesleyan University. And my grandfather said,
You have roots here.
We were born there. And Middletown has a big psychiatric hospital. And they used to say to the children, behave yourself or you'll go to Middletown. And I ended up volunteering at that psychiatric hospital while I was in
You wanted to truly show your roots.
Yes.
Which relatives lived on Eastern Parkway in Brooklyn?
That was my maternal grandparents.
And they were in the bakery business? Or
Yeah, my maternal father was a baker.
And the other side was the haberdasher.
The other side was actually became ultimately a tobacco salesman.
Right. He were at Davidoff.
That's right. That's right. Down on Wall Street. Yes.
Now you told me that your father went to NYU
as a graduate student. He went to City College.
City College. Prior to that, he was in
Townsend Harris High School.
And then he was in the military.
Yes, 4.5 years in the Air Force.
And how did Mom meet Dad, who worked as a bookkeeper in the bakery?
My father's mother worked as a bookkeeper for my mother's father, and they brought the two together.
So they get married after the war.
Yes.
And you're born in Brooklyn. So look, it could have been Ebbets Field, it could have been Flatbush.
Yes. Empire Boulevard.
Empire
Crown
Boulevard, not too far from Ebbets
Heights.
Field.
That's not too far.
You went to public school at Ethical Culture.
Yes, in Brooklyn, just for kindergarten.
And then what happened? Your father said,
And then-
we're going to the promised land, New Jersey?
We are. So he had 2 kids, wanted to put us in public school, and so we wound up in Teaneck, New Jersey. He had a friend who moved there, and we moved there.
Your father has his PhD from NYU in psychology. How did your father decide that he wanted to become a psychologist?
Well, my father was always on the line between law enforcement and social activism. He worked in the Bordentown prison. He worked with street gangs in New York City and did his doctoral thesis on the street gangs. And he wound up doing this social psychology as a social activist type of career.
Now, you said to me your father had a friend who was really his mentor, Dr. Friedman, right?
Alfred Friedman, a psychiatrist who was chairman of psychiatry at New York Medical College and had an international reputation. He was his mentor.
Now, your father then created the center?
Yes.
Or
He created a program called the Center for Comprehensive Health Practice, which was intended to treat people with drug problems, substance abuse problems, alcoholism, children who needed early intervention, and ultimately it morphed into a place where they did primary care and behavioral health care in an integrated fashion.
and they were affiliated with Metropolitan Hospital,
Yes.
located within the hospital.
Ultimately, they had several locations.
Right.
Ultimately,
Centers around.
they were there.
So when you were a kid, you said to me you were in the Rockaways or sometimes?
Yes. We spent 2 or 3 summers renting a
bungalow?
second floor of a house in the Rockaways. And my grandparents, my father's parents, lived in a single-room rooming house in Rockaway in the summer.
Now, you said you were a pretty good baseball player until the age of 14. What
Yes.
happened?
I was a little young for my age for grade school. 13, all state Babe Ruth League. 14, I get to high school. Most of the kids are 15. I'm no good anymore. I can't hit a curveball. My career is shot. I continued on for a few years, but basically became a relief pitcher.
But you were still on the team.
I was still on the team, yes.
When you graduated in '72 was a time of Vietnam,
Yes.
time of civil.
Yes.
So let's talk
Yeah.
about those days, especially the Life magazine article.
Well, there was a book written about Teaneck High School called Triumph in a White Suburb. We were the first place that was bused in order to integrate, and I was in that first class. We had a central 6th grade. Then the high school had a lot of racial conflict, and they brought in people from Columbia to do encounter groups. We had the Cambodia teach-in, etc. But what you're referring to is out of the blue, some Life magazine reporter, her name was Sarah Davidson, she's still around, was doing an article on the youth in America and somehow wound up at Teaneck High School, somehow got my name along with a couple of others, and I wound up being interviewed in Life magazine. And
only I could find that article.
And you found that article, and my family and my friends tortured me about that article for many years.
So you're at Teaneck High School. You graduate. How do you decide on Wesleyan?
I at that time was sort of a left-wing, sort of political activist person. I wanted to go
Short hair, if I remember. With very short hair, as you can see from the pictures that we have, yes.
I wanted to go to a school that didn't have too many requirements. There were a few of those. Brown didn't have much, Wesleyan didn't have much, and Wesleyan was the best school I got into. So I went there without much knowledge of the place.
So you go to Wesleyan, no baseball?
Only intramural baseball, not.
So you're at Wesleyan, and you join a fraternity and you make it a food co-op.
Yeah, there was a
I mean,
fraternity.
true socialism.
It was. It was.
That's how the HMOs and everything.
That's right. That's right. And that's how the management career started, because I was the manager of that. So
What do you mean by the manager of the
I
food
collected the dues. I did the shopping, and other people did the cooking and cleaning and whatnot.
So you
And I
learned
did the business.
delegation very well.
Delegation and business.
But you're there. You're in a liberal arts program, and you're thinking maybe law
Yes.
or maybe psychology.
Yes.
What pushed you over? Because I think you took the LSATs and the,
Oh yeah,
and the MCATs.
And I was a debater in college. I was myself and my partner were national debate champs in college. But I had been inculcated from in the womb to be a doctor, and
You're at Wesleyan. You finally decided that you're going to go into medical school, and then you had the opportunity of going to a couple of them. But you went to New York Medical College.
yes, my father had a faculty appointment there. They had a tuition remission benefit for the faculty, so
See,
I went there.
Where are you living at this time?
I lived on 85th and between York and East End.
Is
A
that-
shared apartment.
Right,
with
but they had the school was here as
Yes.
opposed to in Valhalla
Yes.
over there. And so when did you decide that it was psychiatry, not internal medicine, surgery, or something else?
all those things you said at the very beginning, those confused things, convinced me that I needed to have at least some degree of pondering who I wanted to be, where I wanted to be. So psychiatry was a natural for me. It was the field my dad was in, his mentor was in. They didn't want me to go into psychiatry, so I convinced them that I would do the interface between psychiatry and medicine, consultation psychiatry. And so I decided that the best program was at Mass General.
Now,
And so I decided that would be the goal to try
let's
to get
talk
there.
about the truth of how you got into Mass General. You like that, but it was baseball.
It was baseball. So I went up there for a rotation as a medical student. Happened to be in the spring. They had an intramural baseball team. They played the cafeteria staff, the Department of Medicine. They recruited me for the team. I played well, got myself noticed, and frankly, that put me towards the top of the list as they chose residents.
So the kid who was born in Brooklyn, living in Teaneck, Connecticut for college,
Right.
medical school in New York City,
Winds
now
up in
goes
Boston.
to Boston.
Yes.
Boston.
Yes.
So let's talk about the first couple of years up in Boston. So residency is what, 3 years?
4 years.
4 years. And then what happens?
Well, I expected to go up there, train, and come back.
Have a little office like Freud.
Right. Things happen. Met a woman. We got together, stayed there, decided to get married, and to make a long story short, I ended up having my career up there and
But
spent
let's talk about
18
your
years.
career, because you were thinking you're going to be a practicing psychiatrist, which
Yes.
you were the chair later on
Yes.
of psychiatry. But how did you get into management?
Two ways. Number one, at that time, the mental health field was being inundated with managed care. And so from that perspective, I needed to understand it. And number two, my department chair asked me, he said, you seem to have some leadership promise. Why don't you go over to our state-affiliated clinics, cut your teeth on that, and then I'll bring you back in a few years to be a leader over here. So I got into management when he put me over
But you
at
were
these
young.
clinics. I was young. I was 28.
28, okay.
And had a multidisciplinary staff, and ultimately ended up leading the community mental health centers in Boston that were affiliated with Mass General.
Then it's 5 years later. What happens next?
Well, 3 years later, this department chair named Tom Hackett, 59 years old, riding a horse on a weekend, dies in the saddle. And there were no written plans or anything about the future, so I wound up staying there, trying to maximize my activity there, and I stayed there in varying roles until 1991.
And 1991, what happens? That's when the world is truly changing.
Truly changing. 1991, Harvard University decided to hire a single chairman of psychiatry, and all the other departments bought in. And one department that bought in was at the Deaconess Hospital in Boston. They didn't have a department, and they selected me to found the Department of Psychiatry and be the first leader up there.
So you're working at Deaconess, but you're also working in administration.
I am, because at that time there was a privatization of the public mental health system, much like's going on in New York now, but this happened 20 years before that. And so I ended up bringing a bunch of the public programs into this private hospital, the Deaconess, got support from the hospital president, learned to present in front of boards, and really gotten taken under the president, his name was Dick Gaitner's wing, and really started getting into medical administration.
And dealing with HMOs.
Dealing with HMOs, dealing with managed care. I had more experience with managed care than the medical or surgical people, so the chairman of surgery asked me to be the vice president of the medical staff for managed care, and then we began to grow a network, and I became medical director of the network, and slowly started moving into more generic medical management as opposed to just psychiatry management.
When you were on PBS on the Frontline show, you made a quote that the change of health care with Pepsi and Coke. What did you mean by that?
Well, what happened is in Boston at that time, Harvard had 5 or 6 teaching hospitals, and when Mass General and Brigham and Women's came together, that was tectonic plates. They formed Partners Healthcare, and all the other hospitals then decided to try to get together. So Partners was Coke, the leading entity, and then ultimately another network formed called Care Group, Beth Israel, Mount Auburn,
which
Deaconess,
you were involved with.
Which I was involved with after having left Mass General.
So you're there, you're rising up, and then all of a sudden it's 1998?
Yes.
And you decide it's time to come back to New York City?
Yes, there were changes up there, both personally and professionally. I thought it was time to come back, and one of the individuals who I met up there, who was the chairman of medicine at Beth Israel, Robert Glickman, became dean at NYU.
And you come back in a situation that we had a similar Coke and Pepsi in New York City.
Yes.
Because it was a time that everybody felt that we have to be parts of these large institutions.
Yes.
We have to merge, as well as NYU was in the middle of a merger with Mount Sinai.
Right.
And you have a new dean.
Yes.
Who totally, the old dean, who I remember and fondly,
Saul Farber.
Saul Farber was a wonderful individual, but he was a dean of the 80s.
Yes.
And not a dean of the 90s, merging, practicing under a new philosophy.
Correct.
And even Bob Glickman was not that, because he was more of a scientist.
He was, and the first meeting I went to between Mount Sinai and NYU, I knew in about 30 seconds that this merger was not going to make it, because I sat next to my dean at NYU and the dean of Mount Sinai, and they kept talking to each other about the fact that they were not supportive of this merger, and they wanted their own activities. And
so they weren't supportive, and the medical staffs weren't supportive.
That's correct.
Either medical staff
That's
was
correct.
supportive. And then, as you said to me when we got together, the third thing which was there was not enough financing for this combined merger.
That's correct.
Over there.
That's correct.
So at that time, Sinai goes on its way.
We go on our way.
NYU goes on your way. And at the same time, there's another guy who comes back to New York from his roots, Bob Grossman,
yes.
who comes back from University of Pennsylvania, running radiology, and then subsequently becoming the dean and CEO
yes.
of the medical center. And joining him on the growth path is you.
Yes. My job, first under Bob Glickman and then under Bob Grossman, was to try to help NYU move into the ambulatory care space, grow the physician network, have doctors that weren't exclusively in private practice, build programs, and move towards a more programmatic academic medical center. That started with Bob Glickman, escalated with Bob Grossman, to the point where we really started building in the 5 boroughs.
How do you, you know, it's always good to be a psychiatrist, especially when you have to deal with different personalities. How do you get a private practitioner who wants to be independent to, I mean, because what you've done over the years, you and Bob and together, you've increased, you know, the size of the practice of people who work for the hospital.
Yes.
You have 1,500 of the 2,000 or 2,200
Yes.
physicians are employees of the hospital.
Yes.
So they're there and they're happy to be employees, even though some of them are saying, I'm working Saturday today
Right.
because the facility is open. How do you get that to happen?
Well, it's a slow process, and then the environment begins to evolve. First, you start with people who spend most of their time in the hospital. But as the environment has evolved, as regulations have been more onerous, as administration has been more onerous, as electronic medical records and all the stuff that is put upon doctors becomes more onerous, you're able to provide value to the doctors by saying, listen, we have an infrastructure that can really help you with this, and you can focus on practicing medicine. We could take a lot of the administrative burden off your hands, and over time, more and more people become interested.
In May, you're going to have a graduation. You have, what, 180 graduates?
160.
160 graduates. Of the 160 graduates, after they finish their residency, based on what's happening today, what do you see? Less than 20% going into private practice on their own?
Oh, I bet it's less than 10%.
So
it is, graduates are, they're either looking to be in they're looking to be in a large group. They're going to be employed, whether it's a private large group or whether it's an academic large group. And most people are now looking for that. And the group model has become the predominant model.
let's talk about the ambulatory, which has, has taken over. I mean, NYU, even though it's a campus within a neighborhood.
Yes.
Okay. Ambulatory care today, what's happening with that?
Ambulatory care has really become the dog, with the hospitals becoming the tail of the dog, whereas previously it was different. I mean, we do over 3 million ambulatory visits a year, and we have about 45,000 hospital discharges. So it's just been a dramatic shift. Much of the technology allows people to increasingly stay in the hospital for a shorter and shorter period of time, to the point where some things that previously required a week in the hospital are now done on an outpatient basis. So more and more, a hospital is increasingly being reserved for people who have rather intensive critical illnesses, and much more of the care is being done in the ambulatory arena, and much more of the surgery is being done in the ambulatory arena.
You know, a number of hospitals in New York, as I said earlier, did mergers. You have one coming up with Lutheran, but you're doing more of certain strategic mergers.
Yes.
And
We're
sites.
really an ambulatory network with a couple of hospitals, whereas other organizations have a lot of hospitals with doctors, or an equal doctor-hospital. So we've sort of embraced this ambulatory design and basically said that's really what we are, with a hospital for those a small percentage of patients who actually need that.
Right. I mean, you're going to be building in Brooklyn Heights.
Yes, an ambulatory.
Ambulatory emergency room.
Yes.
And an ambulatory care, which is not only the ambulatory, but it's going to have a full 24-hour emergency room.
Yes, we're actually operating that right now.
Right, but you're building.
But we're building a new one. Yes.
You're also in the midst of building two new hospitals at the medical center.
Yes. but no increase in beds. So what it is a modernization. We're adding 1,000,000 square feet, but not a single extra bed, just making everything single rooms, having more modern space, but still not looking towards a substantial increase in the inpatient activity.
Let's talk about the hurricane in NYU, which was I mean, you lost your emergency room, you lost the facility, you had to take people out.
Yeah, we lost everything for a couple of weeks, and we lost the hospital for a couple of months, and we are 99% back, finally having made an agreement with FEMA. But that was a, absolute, 9/11 and the hurricane.
You were there for both.
I was there for both. Were two similar, surreal experiences where you just went about your business, got energized, got into action, and tried like hell not to think about what was happening and to just put one foot in front of the other and proceed.
Let's talk a little bit about family. You have a son who's graduating from what, Tufts?
Tufts Dental.
Tufts Dental, and he'll be graduating this May.
This May, couple of months,
And
yes.
your wife is also involved with NYU, right?
Yes, my wife is a research psychologist. She works in early childhood intervention and prevention. And then I have family number two. I have a boy who's 9 years old.
And where's he go to school?
He goes to school at PS 59 on 57th Street in the same building that Whole Foods is in.
What do you want to do in the next career?
I think this is it. I think I really enjoy this. I really enjoy trying to help morph a health system into healthcare reform. I enjoy being very close to the clinicians and try to find out what the next technology innovation is going to be and try to go where the puck is going rather than staying where the puck is. So I think doing that, spending time with these boys who are endless joy, and my wife is very satisfying.
That's great. Thank you for being here today.
Thanks so much for having me.